Healthcareonomics, changing healthcare by changing the way you think about healthcare. Hi, everybody, and welcome to Healthcareonomics. I'm Dr. Kevin Wacasey, the creator of Healthcareonomics, and this episode of Healthcareonomics for Employers, I have my guest, Sheron Sidbury. She is an independent insurance agent and employee benefit specialist from the Alexandria, Virginia area, one of my favorite areas of the U.S., outside of Dallas-Fort Worth, of course. But basically, she lives and works in the Washington, D.C. area and services Maryland and Virginia for her employee benefits. She's been doing this now since about 2008, and Sheron focuses on individuals and servicing small businesses, including what she calls micro businesses, which is a fascinating term that I want to get into. And Sheron, I want to welcome you to the show, and thanks for coming on.
Thanks for having me.
Oh, you're welcome.
Well, I'm glad to be here.
You're welcome. Well, the reason, let me just say, the reason I asked you to be on the show, and this is our third episode, is because I have a Twitter following. You and I met on Twitter about a year ago, and it's always nice to put a face with someone and a name with someone and a voice who, you've been chatting with and liking and retweeting their stuff for about a year. It's really nice to meet you finally. But the reason I asked you to be on the show is because you seem to, now we've never talked in real life other than just a few minutes before we started taping. And I believe that you and I probably share a lot of the same ideas when it comes to health insurance and healthcare coverage for employees through their employers. So why don't you tell us a little bit about what you're doing there in the D.C. area, and then we can get into some other topics.
Okay, well, basically I started out working with individuals, which I thought they were individuals. Over time, I got to know my clients, and I found out that a lot of them are sole proprietors or self-employed. And then a lot of them also have what are called, I call them micro businesses. A micro business generally has 10 employees or less. Most of them have maybe 2.
Yeah.
But with these people, when the ACA started, things started to get complicated for them, and they actually needed to find solutions to be able to just afford what was considered to be affordable health insurance. But it was very, very difficult because of the way small business owners' income go. I'm also one, so I know exactly where they are. But I don't have an ACA plan, so I wasn't in the same boat, but I still had to help them to find solutions. And that's how I started working with them.
So these are folks, when you would find these clients, these are folks who either didn't, because I'm a micro business myself. I'm a one-man show, you're a one-woman show. And basically, I've had the same health insurance plan for, almost 20 years now. So I had the grandfathered in special. Now, that's not to say the price didn't go up, but I don't have an Obamacare policy. I have a policy through Blue Cross Blue Shield that I've had since, the early 2000s, and I just never gave it up. So, but you're saying that the clients that you have, a lot of the clients that you had were folks who either didn't have a grandfathered plan or were seeking health insurance for the first time, and they're stuck in that Obamacare marketplace, correct?
Exactly. Because even if they go with a small business, because there's something that changed in Virginia recently, where if you're a one-man show, you can get an employer-sponsored plan. But the problem is you do not get a subsidy to get that plan.
I see.
So if they were paying like $200-$300 a month without the subsidy for a family, they're going to pay upwards of $800-$900 a month.
Gotcha.
So even though those plans cost a little less than an ACA family plan, it still is not a bargain for them. So they're kind of like stuck in the middle unless they want to pay out of pocket everything for a health insurance plan.
So again, to get into our philosophy, our combined philosophy, correct me if I'm wrong, but I bet you're somebody who tries to coach your employers and your clients that, health insurance is really not something that you should be buying to cover all your health care. Health insurance is something that really is like, as I like to say, it's like a chainsaw or a fire extinguisher. It's there in case of emergencies only, and you should try to find a policy like that that covers emergencies, and for the rest of your health care, you just pay for it. Is that That's your model? That's what you're doing?
Exactly.
I
But
figured.
that's a hard thing to get people
Oh,
to understand, because for me, health
no kidding.
insurance is what I call a health financing tool. It's
Hmm.
not health care, but it's something to help pay for it. But the issue that I have with the plans today is, even what is considered to be a catastrophic plan under the ACA is not a catastrophic plan. A catastrophic plan is a plan where you pay not that much for it, and it
Right.
basically is a deductible. You
Right.
decide, my deductible is going to be 5,000. This is what I'm willing to pay. Once
Right.
I hit 5,000, then you take over. And
Yeah.
these people are people that generally want to pay mostly for their own health care. I have one client where, when we first started out, she has a driving school. And the thing that she was really frustrated about is, she said, I never get sick. I've never had health insurance. I just want something that
And-
will
yeah.
cut off the edge when I end up in the hospital. And she
That's
used to
right.
pay her doctor in cash. That was the first time I started thinking, maybe there's a better way. And so it just started to steamroll from there. But yes, health insurance really is not something that you should use to pay for every sniffle and sneeze. And
Right.
that's what people
Right.
want it to do.
Exactly. There's so much to unpack in your statement. So much to unpack in what you just said there. We could do an entire show on that. And I'm encouraged to hear that there are people out there, and I've ran across them too. A lot of
Hmm.
my patients in my DPC, my direct patient care practice, are small business owners. Individuals and families who have their own businesses,
Hmm.
and those folks generally get it. They understand because they have not had
Yes.
these. They don't work for the giant tech corporations or the municipalities or the unions with their
Hmm.
solid employee benefits. I wrote a blog piece a few years ago now about a blind date I went on. Still have never talked to her since, but I called it Touche, and the woman's name was Shay. But basically, we sat down to eat dinner, I believe, and she told me that she worked for some giant company, a telephone company, and I was intrigued. And at that point, I was still on
Hmm.
fire about my discovery about health insurance, and I started grilling her about her health insurance. And I said, hey, what kind of health insurance do you have? She goes, oh, I have great health insurance. What do you mean by that? Oh, it covers everything, down to mammograms and doctor visits and stub toes. Oh, everything's covered. And I said, well, that's not really insurance. So anyway, she walked out on me after the chips and salsa had gotten served, because she was having none of that. Because I told her, I have
Hmm.
5 words for anybody who's got that kind of health insurance plan. Enjoy that while it lasts, because
Hmm.
it's not going to last very long. These employers are getting sick and tired of paying so much for it. So
Yes.
you're working with a particular group that basically has already seen the light and is more welcoming of your message and your services. Have you still
Yes.
had some difficulties, though, in getting that across to people? Do you still encounter a fair amount of inertia?
I do.
Yeah.
Because most people are stuck in the thing that health insurance should be covering everything. Uh, they feel, well, they listen to the news. And in the
Yeah.
news, I'm sure you're aware that everything is called junk. Anything that does not cover you
Right.
100%
Right.
is considered junk.
Oh, and it's all
But
considered health care, too. I love that. You know me, I
exactly,
rail on that on
exactly.
Twitter about health insurance is
And
not health care.
exactly. And what I try to get them to see is, there is no plan today that actually covers you 100%. Nothing, not even
Right.
the ACA. The
Right.
ACA talks about their essential health benefits. The companies have already figured out how to get around that. Some companies, ER visits today, you can't go to the ER for something that you consider to be an emergency, because they may not consider it an emergency, and therefore they will not pay, which kind of nullifies emergency room EHB. Um, Other
Right.
plans that you probably heard about, the health sharing organizations, they don't cover you 100%. They're not guaranteed. They're not even insurance. Short-term medical plans, they're limited benefit plans. These plans were never created to cover you 100%. It gives you some coverage, but the thing that a lot of people are either afraid of, or don't want to do is that personal responsibility thing, is
Mm-hmm.
to shop around.
Yeah.
And
Yeah.
what I've taught a lot of people to do is shop around for other services that you either pay cash for or something that will give you 80% of the benefits. And that's what I find with direct primary care when I stumbled across it about a year ago.
Yeah.
That's how I met
Yeah.
all of you guys. So
Right.
so that's
Right.
what I encourage people to do. I was looking at a plan the other day. I was talking to a lady on the phone on Sunday, and what I noticed is a person just in my area in Alexandria, if you make like $47,000 a year, a plan on the ACA, which is their bronze plan, it costs you a little over $200. But
A
if you
month.
want a month, if you
Yeah.
want co-pays and all of that in there, then you have to pay an extra almost $200 a month. So the issue with a lot of my clients is at the end of the year, I get the complaints, oh, I don't use my plan. I haven't gone to the doctor. Why am I paying this money? And I'm
Yeah.
like, you don't have to. But getting them to understand that a bronze plan, even though I still consider them to be bad because they're bloated, but they're still, in that case, if you're not using it, don't pay the extra two or three hundred
Yeah.
dollars.
That's
And
the
that's
whole
the
purpose of
hardest
insurance,
thing.
right?
Exactly.
It's to not use it. Go ahead. I'm
Exactly.
sorry.
And that's the hardest thing to get people to understand. And there's so many things that they can use. The things that I personally use. I've gone online when I a long time ago before my doctor quit. She
Oh
quit
no.
because of the EHR, which I did not know what the electric health records were until I came on here. But that's the reason why she retired. But
Oh,
when I started going to her, I had a slight cholesterol elevation, and she wanted me to take, it was actually a vitamin, which I did it, and she wanted me to wait 6 months to see if it worked. So I
yeah.
did that, and I went online, but I wanted to know, is this working before I went back because I was nervous about it. So I looked up online a service called Request a Test.
Mm-hmm.
To do the lipid test was $29.99.
Mm-hmm.
So I put in my order, went and got the test done, and actually what she gave me did work. But that just kind of got me thinking. I didn't go through my insurance,
Yeah.
but I did that online. And I was like, if this is $29.99, when I get that little thing that says this is not a bill, when I go through my insurance, when it's done in-house at the doctor that I'm at now, it costs
Yeah.
$179,
Right.
same exact test.
Right.
And there's some other things that I've done um, to save money on healthcare costs. And there's so many things that people can do that they don't know about, and it's not unaffordable. It's
Right.
really not unaffordable.
Exactly. And, one of my taglines is not the costs of healthcare that are outrageous, it's the charges. But we're
Mm-hmm.
taught that every day in the media. I've written a couple of books, as I'm sure you're aware. You've probably seen them
I
advertised.
have them.
And, thank you very much. Appreciate that. Please review them. But
I've read them.
if you haven't already, please, yeah.
Yeah.
So the bottom line is that it's we're taught this every day, and this is the biggest fake news
Mm-hmm.
story going in a long time, if not forever. This
Mm-hmm.
whole idea that health insurance equals health care, and you must have health insurance because healthcare is so expensive, it's so costly. I call that the big
Mm-hmm.
myth of healthcare, and
Yes, it is.
it's alive and very, very well these days. It's really crazy. You mentioned something earlier, though, and I wanted to get back to it because it was a key
Mm-hmm.
point that I've not made enough myself. But I think we need to shout this from the rooftops as much as
Mm-hmm.
possible, and that is this: that if you have a $5,000 or a $10,000 or maybe even a $3,000 deductible on your health insurance plan,
Mm-hmm.
then congratulations, you
Mm-hmm.
have catastrophic health insurance, and there's
Mm-hmm.
nothing wrong with that. That is like having a catastrophic homeowners plan or a catastrophic auto insurance plan. The
Exactly.
only difference is, as I see it, and you touched on this earlier, is I think you said bloated. The only difference is how much you have to pay for that health insurance plan.
Mm-hmm.
That to me is the real problem with health insurance these days, is not how much it covers or will not cover, it's how much
Mm-hmm.
it costs you to achieve that coverage. So let me ask you
Exactly.
this. Do you see or do you have any kind of ways that you're working with your clients to bring those costs down other than the good advice you're giving them about limiting their coverage, et cetera?
Yes. I've given them the example. One thing that I've done is, I don't know if you ever heard of Groupons. This is just an
Yeah.
example.
Yeah.
I never knew that certain doctors will offer their services through Groupons. Some of my people, they go to chiropractors. Chiropractic
Yeah.
services are included in ACA plans today. I told them just go to Groupon. Sometimes you can get a service $15, $30,
Hmm.
$50. Dentists are on there, optometrists are on there. Occasionally, Lifeline screening will also be on there. The
Wow.
other
Yeah.
thing that I try to get them to do, because the kind of plan that I have and that you have don't exist anymore.
Right.
So the only option that they really have if they want a so-called ACA plan is a bronze plan. For me, having everything included, it doesn't really make sense because it just drives that cost up. I do have a couple of people, I didn't sign her up for this, but she just went ahead and went with a health share because it was cheaper for her. She didn't know what her income was going to be. I also gave her the suggestion of trying an HSA, opening up an IRA, which she did both, but it still didn't get her income down enough. And she was scared of what if it didn't stay down enough to get a subsidy, which that could be disastrous the following year. I
Mm-hmm.
also have talked to people about using limited benefit plans if you have a bronze plan, because they can be considered not so good if you're dependent on that for your health insurance needs because they don't cover a lot. But
Mm-hmm.
there are some that will cover $1,000 a day, $2,000 a day. And
Oh,
if your
wow.
deductible is 6,000, if you're in the hospital for 3 days, then you cover your deductible with the
Yeah.
limited benefit plan.
Yeah.
But yes, when they're not paired with something, to me, something is better than nothing. And I
Right.
always feel that when they try to drive people away from the other, I call them options, I don't call them alternatives. An alternative replaces something. An option is a choice that you make to cover your needs. That's just how I look at it. So I don't look at any of the options as bad.
Right.
They've even done that with direct primary care. They're like, well, what if you get hit by a bus? Direct primary care purpose is not to treat you
Right.
when you get run over by the bus.
That's right.
Limited benefits are not there to treat you for everything indefinitely into the future. That's what people can't get through their heads. They just
That's
listen to
that's
the
a
news
great
and
point.
that's about it.
That's a great point that you're making. There is no now, that's an awesome point you just made. I've never really put that together myself, but thank you for congealing that in my mind. There is no one solution anymore. It used to be, I'd like to say that health insurance, when I was a kid, I just turned 50. And when I was
Hmm.
a kid, health insurance wasn't insurance. I mean, it wasn't
Yeah.
insurance up to about 15 years ago. It was just prepaid health care with your
Hmm.
$5 copay. So you paid all this money into the health insurance company, and then they took care of everything. They were like the
Hmm.
mafia. It was protection racket. So nowadays, what we have is a truly insurance product where if you have
Hmm.
$1,000 or $3,000 or $5,000 deductible, congratulations, you're a consumer. So,
Hmm.
and you just nailed it. There is no health insurance plan anymore that I'm aware of, and I'm sure you're not aware of any either,
Hmm.
that covers everything. That gives you that $5 copay anymore. I think that's why
Exactly.
Americans are so ticked off, is because their health insurance has been taken away from them, when the reality is it was the
Hmm.
prepaid health care that was taken away. It ain't coming back. I mean, I've pointed that
Yeah.
out many, many times. But you're exactly right. There is no one stop solution. I am a direct patient care or direct primary care physician myself. I have my own
Hmm.
practice in the Dallas Fort Worth area. I tell my patients, hey, I ain't a one stop shop. You break a leg,
Yes.
off to the hospital you go. You have chest pains, you got to go to the hospital. I can help
Exactly.
you with most things, and I save people a lot of money when they call on me. But, I've met so many people. When I tell them this analogy, they say, oh, that's crazy. I would never buy a home warranty. Maybe I'm crazy because I don't believe in health insurance covering everything, but I do believe in warranties. I buy warranties all the
Hmm.
time. I have warranties on the electronics I'm using to record this right
Hmm.
now, because when these things break, I go and take it back and I get a new one, and I just buy a new warranty on
Hmm.
it. Pardon me. But the bottom line is that I liken DPC just as I have homeowner's insurance on my house in case it burns down, I also have a warranty that I routinely use. If my air conditioner kicks out on me, I got that covered. I mean, I don't. I gotta, so it is like an insurance plan for me. That it's a risk, but it's a risk for me that's worth taking. A few $100 a year spent on a home warranty is worth potentially saving thousands on a new air conditioner or a new refrigerator or what have you, in case it breaks down, or the repairs needed to fix these things. Especially in Texas, in July and August, when that air conditioner starts making noises, I'm like, I got that thing covered. Well, to me, that's what DPC represents. It's more like a warranty in combination with an insurance program that helps you in case you get hit by a train or a bus or what have you. So thanks for making that point. I mean, that's a really good point. There is no one-stop shop anymore. There is no one-stop solution.
Exactly. And that's kind of my thinking, because I always tell people, you can buy a health insurance plan, but you need to design your own healthcare financing plan. And the way you do that is you decide what you want to pay for. You can do a combination of things. And today, that's really what you have to do. For a person that doesn't want to spend a lot, if you want to use direct primary care, do that. And then get something to cover the things that doesn't cover.
Absolutely.
If you're not using direct primary care, talk to your doctor. Ask them, do you have a cash payment? In the office I go to now, it's $100. If you don't have insurance, that's what you pay. So it's just asking around and deciding, what do you want and what do you want to pay for? But in general, it's making that package to cover the things that are important to you. But people, sad to say, a lot of people don't think. And if you give them suggestions and it doesn't sound like what the mainstream goes with, then you're wrong. And then they just go into it. That's just the way it is. And usually when I get to the end of the conversation, I tell them, I can't decide for you. You have to make that decision. So that's just the way it goes.
You just reminded me of why I asked you to be on the show. Is because I think your frustration shone through a couple of weeks ago. You put out this wonderful tweet. And what I love about tweets is the little bits of fantastic philosophical knowledge encapsulated into 280 or less, sometimes 140. And you said, those, and I remember this distinctly, I'll quote you. You said, those who only hear what they want to hear will not reap the savings. Boom. I can't, that's beautiful. I mean, that is philosophy right there, I'm telling you, because people who are stuck in this mindset, they're not going to save money. They're going to be doing the same old. Every summer I put out a blog piece now on healthcareonomics.com, and I call it the Texas Teachers Series. And I've put this thing out now since 2013, 2014, I believe. It's crazy. The Teachers Retirement System of Texas is a quasi-governmental agency that rips the employees of Texas school districts, including teachers, off mercilessly. I mean, would you, and I have this formula I call Dr. W's equation, P plus O equals W. That's premium plus out-of-pocket maximum. Forget deductibles. It's your premium plus your out-of-pocket maximum equals what you could spend. The app's available, by the way, on Android and iPhone. Don't forget to get the app. $15 could save you thousands more on your health insurance. But the bottom line is that when these teachers, I got a hold of some numbers back for the 2015 calendar year, and I was shocked to find that these teachers, would you ever, Sheron, spend $3,000 extra in premiums just to take $1,500 off your deductible?
No, because you have to do the math. And that's the main problem. People don't do the math.
Well, guess what? That would be like, that's like shoving $3,000 down a slot machine that might pay you back $1,500 if you win, or in this case lose, with health insurance. Would you, I mean, it's shocking to me. 45,989, almost 46,000 people. Most of them, I'm sure, are teachers. These are ISD employees in the state of Texas. Most of them teachers fell for that nonsense in 2015. They bought those upgraded plans. I'm pretty sure in the thought that, I need this better health insurance plan to take care of me if I get hit by a train. My question is, How many of these teachers are teaching our children math?
A lot.
Gosh, I hope not too many because, and just okay. I'm going to say this. Just last week, I put out a tweet where I had a cartoon and there's two buttons on there
Hmm.
and then there's a superhero. It's a meme and there's a superhero. Obviously he's dressed up like a superhero and he's like sweating and he's got his hand up to his face and he's like, which
Hmm.
button do I push? Which one do I push? And over the buttons I put, something like X plan, gold plan with $1,000 deductible
Hmm.
and it's so and so a month. And then I put the bronze plan. It had a $5,000 deductible, okay, which is 4,000 more, but it was $500 more a month. Now
Hmm.
here's the kicker. I had a full professor of economics. I won't say who, I won't say which university. A full professor of economics tweet me back and said, "Well, what's wrong with spending $500 more a month to save $4,000 a year?" And I said, "You mean spend $6,000 a year to potentially save $4,000 a year?"
Hmm.
Silence. Didn't hear anything back. But I know this man isn't. It's not an IQ problem. It's an EQ problem. He's
Hmm.
emotionally bound to this whole health insurance idea that
Yeah.
lower deductible means better care, means better insurance. Do the math, folks. Figure it
Hmm.
out. I mean, I'm telling you.
But that's the myth to get people to spend more money. But
Yes.
they don't get that. But the things you really have to think about is how often in your life do you actually use health insurance? What I usually tell people, think of your deductible as a credit card. Just because you have a $5,000 limit does not mean
That's
you have to
perfect.
use it.
That's
But if you
perfect.
use the $5,000 limit, then you're going to start getting a bill in the
That's
mail.
perfect. Yeah,
As
that's
far as the
perfect.
deductible goes, if you go 20 years and you never use that deductible, but you spend an extra $500 a month for 20 years, that's a whole lot of money.
That's a
And
house.
exactly. And so generally I tell them you need to really think about that. But the other thing is I've used my health insurance in my life twice. I'm
Yeah.
talking literally twice. I've been in the
Yeah.
hospital twice. And both times I've had a high deductible. It took me 3 years to pay it off, but you can do things like talk to financial services at the
And
hospital.
negotiate.
When you talk to them, they will set up a financial plan. You can either make payments, which I never qualify for anything to be wiped out. But the point is, they ask you how much can you pay a month? You pay it off. It took me like three, almost 4 years to pay off the $7,000. But the facts are, people are thinking, oh, well, I have to pay this whole thing right up front.
Yeah.
If you don't touch it, you never pay it.
That's
But
right.
that's
That's
something I
right.
tell people that over and over again. Some people get it, but sadly, the majority of them cannot see beyond that because on the news, they tell them, well, you have to pay your whole deductible before anything gets paid for,
Well, I will tell
which
you,
is,
if I could add just two words to your saying earlier about how often do you want to, or how often do you use your health insurance, I would add want to. And
hmm,
I try to teach people this is health insurance is something you don't want to use because it
exactly.
implies disaster, it implies catastrophe, it
Hmm.
implies that you've had a kidney stone and you had to go to the ER on the weekend or something. It
Hmm.
implies that you got hit by a train. So let's try and not invoke the health insurance thing. So I would change
Hmm.
that up. Well, Sharon, that's about all the time we have for today, but I've really
Okay.
enjoyed this and I've learned a lot already in just this 30 minutes. So I would ask that you please come back at some point on the show
Okay.
if you don't mind. Would love to have you back. In the meantime, though, tell us how folks in the Virginia and Maryland areas can get a hold of you in case they want to explore their insurance options or want to change things. So tell us how we can get a hold of you.
Well, my website is are my initials, which is SES insureme.com. That is my website.
The links will be
And my
below.
email is my name, Sharon, SHE, not A, RON, at sesinsureme.com. So you can
Again,
either
yeah.
email me, you can contact me at my website. My phone number is 703-568-0654. And if you're in Maryland or Virginia, I'll be willing to help you out. Speak Spanish or English. same thing.
Ah, sí, se habla español también.
Sí,
Okay.
hablo español.
Great. That's perfect. Perfecto. All right. Well, great, Sheron. Thank you so much. The links are going to be below, folks. And once again, I appreciate everybody joining in today. Healthcareonomics for Employers. Check out my other videos if you want to. Please like this video, subscribe to the channel, and hit the notification bell. As Paul Watson says, it really helps me out when you do that. So please do these things. You can check out my blog at healthcareonomics.com, read my books, use my app. But again, I want to thank everybody for joining us. And until next time, Sheron, everybody stay healthy. Now you can easily compare health insurance plans and pick the one that makes the most financial sense with the Dr. W's Equation app, available for Android and iPhone. And for more information on how you can save on health insurance and healthcare, check out my books, available now on Amazon, iTunes, and Nook. To help spread this message, please click the like button on this video. You can also subscribe to the Healthcareonomics YouTube channel and visit healthcareonomics.com.